Good morning, everyone. Myself, Harini, I'm Associate Professor in Malareddy Institute of Pharmaceutical Sciences. Today, I'm going to deal with the topic Introduction to Dosage Forms. Coming to the contents which I would like to discuss today are introduction to the dosage forms, classification of the dosage forms, and solid dosage forms, liquid dosage forms, semi-solid dosage forms, and newer drug delivery systems. So first of all, let us discuss about the dosage forms. What are dosage forms? Dosage forms are the means by which drug molecules or APIs are delivered to the site of action within the body to produce optimum desired effects and minimum adverse effects. So coming to the definition, dosage forms are the means by which drug molecules or APIs are nothing but active pharmaceutical ingredients. So drug molecules are nothing but the ingredients which are used to decrease the disease. For example, if you are taking Dolo 650, the main drug molecule in it is paracetamol. So likewise, the main ingredient which is used to treat the disease is called as active pharmaceutical ingredient or drug molecule. So in order to deliver this active pharmaceutical ingredient or drug molecule to the site of action, what do you mean by site of action? Site of action is nothing but the place where the particular action should be shown. For example, if you're suffering from a head pain, the site of action will be your head. So, likewise, the medicament or the drug should reach to the site of action. It can be reached only when it is formulated in the form of a dosage form, so that it will produce optimum desired effect. Optimum desired effect is nothing but therapeutic effect. Therapeutic effect is nothing but disease treating effect or disease curing effect. And it should produce minimum adverse effect. That is, whenever you are taking a tablet for reducing the fever, it should only reduce the fever, but it should not cause any other side effects like irritation on the skin or any allergy likewise. That is, these are allergies and all the irritations comes under adverse effect. The dosage forms are nothing but these are the, in order to deliver the drug molecules to the site of action, it should be formulated in the form of a dosage form so that it will produce optimum desired effect and minimum adverse effect. So why we have to formulate a dosage form instead of giving the drug as such? So need for the dosage form is for the drug safety and patient safety. That is, in order to protect the drug from the patient and the patient from the drug, we need to formulate a drug in the form of dosage form. So dosage form, as I've said you, it's a combination of active pharmaceutical ingredient and excipient. So it is a combination. API, as I've already said you, API is nothing but active pharmaceutical ingredient. And apart from the API, in our dosage form, we'll have excipients. So excipients are the supporting characters of these active pharmaceutical ingredients. So these are the dosage forms are nothing but the means by which the drug is entered into the systemic circulation. Systemic circulation is nothing but our blood, or it is reaching to the site of action. So in this, the drug is the main part of the dosage form. That is the disease curing part of the dosage form. So drug is nothing but a chemical compound. It is not only used for the treatment, but is also used for the diagnosis and prevention of the disease. Diagnosis, coming to diagnosis, whenever you are having or you are suffering from typhoid or tuberculosis, you will be having some different tests for diagnosis of that particular typhoid or tuberculosis. Even in that kits, diagnostic kits will be using some chemical compounds. They are nothing but our active pharmaceutical ingredients or the drugs. And this drug is also used for the prevention of the disease. For example, it is used in vaccines, preparation of the vaccines. And excipients. These excipients are nothing but they do not have any kind of therapeutic action, and they're inactive ingredients, and they'll not produce any kind of pharmacological effects. the meaning of pharmacological effect is one and the same as sort of therapeutic effect, that it will not have any kind of disease treating effect or disease curing effect. They are all only used in support with active pharmaceutical ingredient and to bind the active pharmaceutical ingredient with other ingredients will be adding some other excipients. And there are many examples of these excipients like binding materials. These binding materials are used to bind all the ingredients together in a dosage form. Dyes, they give the color to the preparation because drugs as such, they will be obnoxious color, and we cannot even because of the color, some of the people will not be able to accept the drugs. And preservatives, in order to preserve the drugs for a longer period of the time, we'll add these preservatives. And flavoring agents to produce the flavor or odor to the particular preparation. Sweetening agents to improve the sweetness of the preparation, and coloring agents to improve the color. And why we have to use dosage form instead of delivering the drug as such into the body? So API handling and accurate dosaging can be difficult. So for example, this is mainly in case of potent drugs. Potent drugs are nothing but those drugs will be which will show toxic effect even if it is given in smaller doses. For example, if some drugs will have their therapeutic action will be shown in 10 mg. So if you are taking 10.1 mg or 10.2 mg also, it will produce toxic effect. So if you are taking active drug as such, if you are taking a bit amount, greater amount, it will cause toxic effect to our body. So we need to, it's one of the reasons why we are formulating the drug in the form of dosage form instead of giving as such. And API, because of maybe these APIs are available in different forms, and because of their size, shapes, and smell, taste, and their low activity, will be formulating it in the form of dosage form. Coming to smell, so all the drugs, as they are very bitter, they cannot be taken as such. And they are also, the smell of the drugs are also obnoxious. They cannot be taken as such, so they need to be formulated in the form of dosage forms. So some of the drugs are unstable to light, moisture, and oxygen. So whenever they are exposed to the light, whenever the active pharmaceutical ingredient alone is exposing to the light, it will get degraded. But if at all it is given in the form of dosage form, it will be protected from the light. So moisture, as a salt, when we are putting it on in an open space, it will be absorbing the moisture, and it will prevent, and it will become unstable. That condition is called as hygroscopic. Some of the APIs will have the property of hygroscopic nature. Whenever they are exposed to the moisture, they'll be degraded. In order to prevent those APIs also, we need to give the drugs in the form of dosage forms. And some of the drugs are unstable to oxygen. In our atmosphere, we'll have abundant oxygen. So whenever these APIs are exposed to that oxygen, they'll get rancid and they'll be degraded. To avoid that also, we need to provide we need to formulate these APIs in the form of dosage forms. So some of the drugs, before reaching the site of administration, because of the varying pHs in our body, they'll get degraded. For example, stomach is having acidic pH, and some of the drugs will be degraded by the acidic pH of the stomach. So we have to formulate them as enteric coated tablets. For example, enteric coated tablets, we'll be binding the drugs along with some polymers, enteric coated polymers, so that the drug will not be released in the stomach, and it will be protected in the stomach, and the drug will be, or the coating which is present on the drug will be preventing the drug from degradation of acidic pH. So the drug will be released only when the particular tablet is reaching the intestine. The upper coating, enteric coated polymer, will be dissolved only in the intestinal pH, and the drug which is present inside will be saved from the stomach acidic pH. And some of the APIs will cause local irritation to the mucosa which is present in our body. to prevent the irritation of the patient by the APIs, we need to formulate in the form of dosage forms. And some of the drugs will be safe and convenient when they are formulated in the form of tablets, capsules, and syrups. So, as I've already said, in order to protect the drugs from the oxygen, atmospheric moisture, we need to coat them with some coating polymers so that polymers will protect the drugs from the atmospheric oxygen, moisture, and pH of our body. And this sugar coating tablets will be available, which will conceal the bitter taste, and some flavoring agents will be masking the odor of the drug substances. So we need the drug to be formulated in the form of liquid or solid or any other dosage form in order to prevent it from degradation, and in order to give it a better taste, and in order to give it a better flavor, and in order to preserve the dosage form for a longer period of the time, we'll be formulating the drugs in the form of dosage forms. And for topical administration, we'll be using ointments, creams, ear, ear topical comes, our ear also comes under topical, and we'll be administering the drug to the ear and nasal preparations also. Some of the drugs will be inserted into the body cavities, like rectum, will be inserting the drugs into the rectum and vagina. Some of the drugs or dosage forms will be formulated in such a way that they will be providing control release mechanism. Control release mechanism is nothing but the drug will be released timely. So if 10% of the drug is released in the first 10 minutes, and in the next 10 minutes only 10% of the drug will be released, so that the drug will be released continuously for a period of 8 to 10 hours. So instead of taking four times a day or 3 times a day a medication, if you take once a day this type of control release tablet, it will be providing us continuous release of the drug, and it will also prevent us from the sudden attacks. For example, asthmatic patients, their release of or the symptoms of asthma will be more during the early hours of the morning, like 3 or 4 o'clock. At that time, we cannot go get a tablet and administer it. So if you are taking this control release tablet, the drug will be released slowly and continuously. So whenever you are having increased attack of asthma, the drug will be easily available to our body, and you can cure it from the asthmatic attacks. And some of the implants, so contraceptives are given in the form of implants. Inhalants like inhalers will be used. So next one is classification of the dosage form. In the classification of the dosage form, the first main classification of the dosage form is based on the route of administration. Route of administration is nothing but from which source or from which place we are giving the particular medication into our body. Whether it is, first one is oral. Oral is nothing but we will be giving it through the mouth. Parenteral. Parenteral is other than parenteral, other than enteric system. Enteric is nothing but the entire gastrointestinal tract from the mouth to the anus comes under enteric system. Other than these sources, if you are giving outside the sources, that is called as parenteral. Para outside, enteric is gastrointestinal tract, like intravenous, intramuscular. Intravenous, the drug will be administered through the veins, and intramuscular through the muscles, which will be given on the hand and buttocks, etc. And topical, that medicaments will be administered on the surface of the skin, transdermal across the surfaces of the skin, and respiratory, it will be inhaled through the lungs. Ophthalmic, they are applied through the eyes. Ophthalmic preparations are nothing but the preparations which are instilled into the eyes. Rectal, the preparation which are inserted into the rectum. Vaginal, the preparations which are inserted into the vagina. Otic, the preparations which are inserted to the ear. And based on the physical form of based on the appearance of the dosage form or the form which it is available, there will be classified into solid, semi-solid, liquid, and gases. So coming to based on route of administration, enteric route oral, as I've said, you tablets can be taken orally, capsules, and the syrups, suspensions, emulsions, and dry powder inhalers, meter dose inhalers, nebulizers. These three comes under vaporizers. These four comes under the uh, uh, preparations which are inhaled orally, especially for the asthmatic patients. Nebulizer, you're very well aware of this. Even the small kids were using nebulizer nowadays to clear their respiratory tract. So all this comes under asthmatic attack. During the asthmatic attack, we'll be using dipodal inhalers, pressurized meter dose inhalers, nebulizers, and vaporizers. Sublingual and buccal. Sublingual is nothing but we'll be administering the dosage form below the tongue. Buccal. Buccal is nothing but we'll be administering the dosage form in the cheeks. Cheeks will be administering the dosage forms. Inside the surface of the cheeks, we'll be placing that tablet that comes under buccal. Sublingual, we'll be placing the tablet under the tongue. So we'll be placing these tablets in the sublingual and buccal position in order to avoid first pass effect or pre-systemic metabolism. First pass effect or pre-systemic metabolism is nothing but before the drug showing its action, some of the drugs will be going into the liver, it will undergo metabolism and it will be eliminated from the body. To avoid that, if you are giving it in the form of sublingual or buccal, what is happening? It will be bypassing this first pass effect and it will be directly going into the systemic circulation and it will show its effect. Then only it will undergo metabolism and then it will undergo excretion and it will be eliminated from the body. Rectal and vaginal. Central, as I've said you, enteric route, it comes under from the mouth to the anus. That is entire gastrointestinal tract. Rectum and vagina comes under enteral route because it comes under gastrointestinal tract because rectum and vagina are the areas which are involved in the gastrointestinal tract. Some of the ointments are prepared for the rectal administration, mainly for the patients who are suffering from piles. We'll be applying this ointment onto the surface. Suppositories, they'll be inserted into the rectum and vagina. Enemas, these are the fluids which are inserted into the rectum to clean the bowel. And those who are having constipation problem, especially in the children, these are monophasic liquid dosage forms. They will be inserting into the rectum and they are used to clean the bowel. Nutritional enemas, so the persons who are unable to swallow or whose veins were not supporting for the administration of the salines or insertion of the salines, for them will be providing the essential nutrients which are required to their body, like bedridden patients and old age patients will be supplying the required nutrients to the rectum. Parenteral, as I've said you, parenteral is to the routes other than the enteric route. The things which comes under parenteral are intravenous to the veins, intramuscular to the muscles, intracardiac to the heart muscles, and intraperitoneal to the layers of the brain, and intracerebral in the brain, intrathecal it's also in the brain, intradermal on the skin, and subcutaneous under the layer of the skin. And topical route, topical again dermal, which is surface, which are applied on the surface of the skin like ointments, paste, creams, lotions, liniments, lip balms, medicated shampoos. Even the scalp is on the surface of the skin, so medicated shampoos and the patches which are applied on the surface of the skin comes under dermal. Mucosal, the administration of the dosage forms to the mucosal areas like ear drops, nasal drops, and ear eye drops, and ointments. Some of the nanospheres and mucoadhesives, they'll be discussed in your future classes. They are novel drug delivery systems. Next, based on the physical form, again we are classifying it into solid dosage forms. That is, if they are appearing in the form of solids, they are solid dosage forms. Shaped nothing but if they have a particular shape and they are taken as a single unit. So if tablets, capsules will be taking it as a single unit or number of units. So that comes under shaped or unit dosage form. We can tell it like that. And tablets, the examples which comes under shaped or unit solid dosage forms are tablets, capsules, implants, and transdermal patches. Patches which are applied on the surface of the skin or comes under transdermal patches. Mainly they are used to treat the things which are under the surface of the leg. If you are having some wounds, we can apply these transdermal patches. Implants for contraceptives. If you don't want pregnancy, we can use the drug. It will be incorporated in the implants. And unshaped. Unshaped means bulk dosage forms like powders. Powders will not have any single unit. You cannot say one powder, two powders. We cannot tell like that. So unshaped is nothing but bulk dosage form. So powders comes under unshaped or bulk dosage forms. Again, in the powders, we'll be having the powders which are taken externally, that is on the surface of the wounds or the surface of the skin. They'll come under external and internal use. Some of the powders will be taken inside the body or orally, which they are the powders which are taken for the internal use. Semi-solid. Semi-solids, the consistency of the semi-solids suppositories, there will be unit dosage forms again. Again, in the semi-solids, you will be having shaped, unshaped. Unshaped in the sense if you have a unit. So this suppository will be in the form of a jellies and they'll be cut into desired shapes, mainly cylindrical shape. So they'll be like jellies and this will be inserted into the rectum or vagina. Vaginal suppositories are also called as pessaries. And if you are not having any particular unit, that is 1, 2, 3, likewise, they're called as unshaped semi-solid dosage forms like gels, creams, ointments, paste. They'll not be having any particular shape or they'll not be counted in the form of units. So they all comes under unshaped semi-solid dosage forms. Liquids. In the liquid dosage forms, first monophasic. As you all know, liquid dosage forms means you will have a solute and the solvent. If the solute and solvent is mixed together, if you are getting as a single phase and the solution is being appeared in the form of monophasic, single phase, it is called as monophasic liquid dosage form. For example, if you take salt water, if the salt is solute and water is solvent, whenever the salt is mixed with the water, the both solute and solvent will be mixed completely and you will get a single phase. Such type of dosage forms are called as monophasic liquid dosage forms. Whenever the solute and solvent is combined together, if it is being appeared in the form of single phase, it is called as monophasic liquid dosage forms. And examples are syrups, spirits, elixirs, tinctures. Biphasic liquid dosage forms is nothing but whenever you're mixing solute and solvent, it is being appeared in the form of two phases. It is called as biphasic liquid dosage forms. In that emulsions are nothing but here the solute and solvent are liquids itself. This is a biphasic liquid dosage form in which the solute is continuously dispersed in the solvent and they are made miscible by the addition of a emulsifying agent. Suspension is nothing but here the solute is solid and the solvent is liquid and the solute is being dispersed continuously in the solvent with the help of a suspending agent. In biphasic liquid dosage forms, whenever these emulsions and suspensions are prepared, if you are keeping it aside, they'll definitely bifurcate into two layers. So the main portion or direction which we need to write on that container is shake well before use. And external solutions, lotions, liniments, there'll be lotions are applied on the surface of the skin with friction and liniments without friction. And gaseous dosage forms, they'll be available in the form of vapors. So aerosols, if you are coming across this volatile anesthetics. Anesthetics nothing but those which are used for the producing sleep. Okay, so they'll be available in the form of gases only. So for example, even in chloroform spray will be there. They are anesthetics and aerodispersion, anti-asthmatic sprays like inhalers and nebulizers. This all comes under gaseous dosage forms. So all that which we have discussed previously, solid, liquid, and semi-solid dosage form. In solids, again, you will have unit dosage forms, that is nothing but shaped solid dosage forms, bulk dosage forms, nothing but unshaped dosage forms. In unit dosage form, tablet, capsules, powders, and pills. Bulk dosage forms, again, I've said you powders comes under bulk dosage forms. These powders can be used as internal powders as well as external powders. Internal powders are taken orally. The powders which comes under internal powders will be fine powders and granules. And the powders which are taken externally will be dusting powders, insufflations, dentrifices, snuffs, and ear powders. In dusting powders which are applied on the surface of the skin for the treatment of the wounds, dentrifices, nothing but tooth powders, and ear powders will be administered in the ear. Tooth powders, because they'll come as external because tooth powders will be washing our mouth and will be spitting it out, but will not swallow it. So it will come under external bulk preparations. Again, coming to liquid dosage forms, as I've said, you will have monophasic liquid dosage forms and biphasic liquid dosage form. The monophasic liquid dosage form in which the solute and solvent will be combined as a single phase, and here solute and solvent will be bifurcated into two phases, that is emulsions and suspensions. Even the monophasic, again, you will have those which are taken internally through the mouth. They are internal, and externally, which are not digested or swallowed inside the mouth, they'll come under external dosage forms. So, internal syrups. Syrups are syrups are the sweetened, viscous, sweetened concentrations of the sucrose. These are syrups are nothing but concentrated solutions of syrup. Syrups are nothing but concentrated solutions of sucrose. Sucrose in the 66.67% weight by volume of the sucrose gives us syrups. Elixirs are nothing but hydroalcoholic solutions. Here the solvent used is a mixture of water and alcohol. Syrups, here we'll have aqueous solutions of different concentrations of sucrose. But the standard concentration is 66.67% weight by volume. That is 66.67 grams of sucrose will be dissolved in 100 ml of water to get a perfect syrup. Linctures, these are used for treating the cough. Drops also comes under monophasic liquid dosage forms. External, that is which are applied on the surface of the skin, liniments and lotions, as I've said, you lotions. These are applied on the surface of the skin without friction, and liniments, these are applied on the skin with friction. Gargles, gargles are the monophasic liquid dosage forms which are used to treat the throat infections. I know you, many of you know about the gargling. We'll be taking the this gargles and we'll be rinsing it in the surface of the throat and we'll be splitting it out. So it comes under external monophasic liquid dosage form. Throat pains comes under the same category of the gargles. There will be also gargling and we'll be spitting it out of the mouth. Mouthwashes, they are used to deodorize the buccal cavity, that is to prevent the bad smell of a buccal cavity because of the growth of microorganisms. We may have bad smell. To avoid that, mouthwashes are used. Sprays, they are applied on the surface of the skin. For example, mousse spray or Volini spray, they'll be in the form of liquids. So they'll be applied on the surface of the skin. So they'll come under external monophasic liquid dosage forms. Eye lotions, eye drops, and nasal drops will also come under monophasic liquid dosage forms. Again, the semi-solid dosage forms will be having internal and external, both internal. These are suppositories, as I've said you, they are the unit semi-solid dosage form, which are inserted into the body cavity. These will be dissolved based upon the temperature of our body. They'll be dissolved and the medicament will be reaching the systemic circulation or blood. And external, which are applied on the surface of the skin like ointment, creams, paste, and gels. Again, solid oral dosage forms. and monophasic liquid dosage forms. As I've said you, these are liquids which are administered externally, and the liquids which are used for the internal administration. Liquids used in mouth, that is gargles, mouthwashes, and throat pains. And liquids applied to the surface of the skin, as I've said you, they are lotions, liniments, and colloidians, which are applied on the surface of the skin. They are external, but they are applied on the surface of the skin. So these are liquids which are used in the mouth, but they'll not swallowed. They'll be spitting it out. We'll be spitting it out. So they'll also come under liquids for external administration. Some of the liquids will be instilled into the body cavities, like eye drops, ear drops, nasal drops, enemas, but externally only. Okay. Enemas, these are the monophasic liquid dosage form which are inserted into the rectum to clear the bowel. And the monophasic liquid dosage form which are used for the internal administrations are syrups, mixtures, elixirs, and linctures. All these definitions and everything will be discussed in the future classes. Biphasic, again, solids in liquids and liquids in liquids. As I've said you, liquids in liquids will be our emulsions. Again, they are of two types, oral and external. External liquid in liquid is liniments, and oral is emulsion. That is liquid is nothing but solute is liquid and the solvent is liquid. They come under biphasic liquid dosage form in which liquid in liquid is maintained. And solid in liquid, that is solute is solid and solvent is liquid. The oral solid in liquid biphasic liquid dosage form is our suspension, and parenteral, some of the injections will also be in the form of suspensions, and external solids in liquid biphasic liquid dosage forms comes under lotions. So semi-solid dosage forms, again we'll have paste, creams, gels, and ointments, all comes under biphasic liquid dosage forms. And our inhaled solid gaseous dosage forms, that is those dosage forms which are inhaled into the lungs directly, that is gases, vapors which are inhaled directly into the lungs through our nebulizers or our inhalers. There the vapors will be directly administered to the lungs, and some of the liquids will be administered directly into the lungs also. They'll be in the form of some of the in the inhalers will have different categories. Some of the inhalers will have solid vapors. Some of the inhalers will have uh, just vapors, that is gases. Some of the inhalers will have solids. In previously, before this nebulizers, we used to have a small inhaler in which a capsule used to be present, and in the capsule we used to have a drug medicament. We'll be placing that capsule, and we used to rotate the piece which is uh, present in the bottom of the inhaler, such that the solid ingredient we used to be falling on the material into the bottom tube, and we used to take the mouthpiece and we used to swallow it solids. So aerosols used to be there, and liquids and gases. In the nose, liquid solutions will used to be inserted like our Nasivion, and whenever we have blockage in our noses, we'll be using some liquids to clear that blockage, and they'll be in the form of liquids, and some sprays will be used. Nasal sprays used to be there. Nasal sprays will also be there to clear the blockade of the nose, and some gels will also be applied into the nose to clean to for the free passage of the air. Some solids are also used for the inhalation. And suppositories, as I've said to you, these suppositories are used for the insertion into the rectum and vagina, and these enemas are also inserted into the rectum. Those, so these all comes under rectal and vaginal dosage forms, those which are inserted into the rectal and vagina. That is, enemas are nothing but these are the monophasic liquid dosage form which are inserted into the bo body cavities, mainly rectum, to clean the bowel and to remove the feces outside the body. Thank you. So this is about the topic which I am discussing now. So in the future classes, we'll be dealing in detail about all the ingredients or all the dosage forms which I have mentioned now, like about lotions, liniments, collodions, linctures, and all these things we'll be discussing in the future classes in detail in our pharmaceutics lecture.